A colonoscopy is a procedure to examine the inner lining of the colon, large intestine, using a flexible, camera-equipped tube called a colonoscope. Here is a detailed step-by-step guide. Shahada 1. Preparation, dietary restrictions. Patients are typically advised to follow a low-fiber diet a few days before the procedure, then switch to clear liquids, water, broth, clear juice, the day before. Bowel preparation. Patients take a prescribed laxative solution the day before to completely empty the colon, essential for a clear view during the exam. This may require drinking large volumes of the solution or taking split doses to ensure effective cleansing. Medication review. The doctor will review medications and may ask patients to stop certain drugs, such as blood thinners, to reduce bleeding risk. 2. Sedation and positioning. Sedation. Intravenous sedation is typically given to keep patients comfortable and relaxed. Some patients may opt for full anesthesia if available. Positioning. The patient lies on their left side with knees drawn up toward the chest, which allows easier access to the rectum and colon. 3. Insertion of the colonoscope. Initial insertion. The doctor gently inserts the lubricated colonoscope through the rectum and gradually advances it through the colon. Air or CO2 insufflation. To improve visibility, the doctor introduces air or CO2 into the colon, expanding it to see the walls clearly. 4. Examination of the colon. Advancing the scope. As the colonoscope moves through the colon, the doctor examines the lining for abnormalities such as polyps, tumors, inflammation, or bleeding. Monitoring with real-time video. The camera transmits live video to a monitor, allowing the doctor to inspect the entire colon and identify any suspicious areas. 5. Biopsies and polyp removal. Tissue sampling. If any abnormal areas are found, the doctor can use tools passed through the colonoscope to take tissue samples, biopsies, for further testing. Polyp removal. Polyps or other small growths can be removed during the procedure using special instruments. This preventive measure helps reduce the risk of colorectal cancer. 6. Completion of the procedure. Scope withdrawal. Once the examination is complete, the doctor carefully withdraws the colonoscope, re-examining the lining on the way out for any missed areas. Recovery. If sedation was used, the patient rests in a recovery area for 30 minutes to an hour until fully awake and stable. 7. Aftercare and results. Post-procedure instructions. Patients may experience mild cramping or bloating from the air introduced during the exam. This typically resolves within a few hours. Results discussion. The doctor provides preliminary results immediately, but biopsy results may take a few days. The doctor discusses findings, treatment, and any follow-up needed based on the results. Colonoscopy is generally a safe procedure, but rare complications like bleeding, infection, or bowel perforation can occur.